Good afternoon and welcome to Open Classroom. I'm Janet Gillow, the Director of Professional Development for the Brown School here at Washington University in St. Louis. And I am so excited about today's program and so glad that all of you are here to join us on the Zoom webinar and also folks joining us on YouTube. You probably know the deal by now. We can't see or hear you. We also can't call on raised hands, but we're just so delighted that you're part of today's conversation. And due to the extraordinary nature of today's program, I'm guessing that we have some St. Louis neighbors that are probably joining us for the first time. So I want to take just a second to explain that Open Classroom has been one of our main community outreach activities during the pandemic. Our offerings are free and they are open to absolutely everyone. So if you would like to learn with us, take in new ideas and discuss, whether you're joining us from South City, South Carolina, or South Korea, you are welcome here. You are welcome to view the more than 100 programs that we've already had. The recordings are available on the web. And you're also welcome to upcoming programs. So I'm going to take just a second to tell you what we have coming up next week. So on Tuesday, August the 31st, Brown School alumna Stephanie Krause is going to be with us. She's giving a talk called Science and Strategies to Support Tweens and Teens in Pandemic Recovery and Beyond. And then on Thursday, September the 2nd, it is the start of our academic year. It's a long-standing Brown School tradition that we have a convocation, and a talk is going to be delivered by Professor Leopoldo Cabasa on a call to action addressing racial and ethnic health inequities in people with serious mental illness. So registration's free, open, welcome. We would love to have you come back. But now it's my honor to introduce today's panel. And I got to tell you, I have so much respect for these individuals that I am slightly starstruck, and I got to get through it. So first, with a deep personal commitment, a wealth of experience, and a proven record of leadership, Mayor Teshora O became the first African-American woman elected leader of the city of St. Louis earlier this year. She ran on a vision of building a city that works for all and reimagining public safety. Mayor Jones was previously the treasurer of the city of St. Louis, and in that role launched the Office of Financial Empowerment to help St. Louisans make better financial choices. The Office of Financial Empowerment's College Kids program helped over 18,000 public school students start saving through educational savings accounts. As a two-term member of the Missouri House of Representatives, she was the first African-American woman in Missouri history to serve as assistant minority leader. Mayor Jones has a bachelor's degree in finance from Hampton University, a master's degree in health and administration from St. Louis University, and she's also a graduate of the Executives in State and Local Government program at Harvard University's Kennedy School of Government. She's also the proud mother of Aiden. And we're also joined by Serena Muhammad. As the Deputy Director of St. Louis MHB, Serena is responsible for managing the organization's $14 million community investment strategy. She leads cross-sector initiatives that focus on alleviating the social, educational, and health inequities that keep people and places from reaching their full potential. Her recent appointment as the Managing Director of the COVID-19 Regional Response Team allows her to lend expertise in system building to strengthening the crisis response infrastructure in the St. Louis region. She staffs the St. Louis Area Violence Prevention Commission and is active in several criminal justice reform efforts. Serena received her BA in English from Xavier University in Louisiana and her MFA and MPPA from the University of Missouri, St. Louis. It's also my very great pleasure to introduce Mary McKay. She's the Niedorff Family and Centene Corporation Dean of the Brown School. Dean McKay's academic experience connects deeply to both social work and public health. Her research focuses on meeting the mental health and health prevention needs of youth and families impacted by poverty. She has expertise in child mental health services, as well as over 20 years of experience conducting HIV prevention and care-oriented studies. Mary has authored more than 150 amazing academic publications on mental and behavioral health, HIV/AIDS prevention, urban poverty, and more. And finally, rounding out this amazing panel, Sean Joe is the Benjamin E. Youngdahl Professor of Social Development at the Brown School. He is a nationally recognized authority on suicidal behavior among Black Americans, and he's expanding the evidence base for effective practice with Black boys and young men. His research focuses on Black adolescents' mental health services use patterns and development of family-based interventions to support urban African-American adolescent males. Professor Joe is the principal director of the HomeGrown STL initiative, and he also founded the Race and Opportunity Lab here at the Brown School, which examines race, opportunity, and social mobility in the St. Louis region, working to reduce inequality as adolescents transition to adulthood. Wow, what a panel. Here to moderate conversation between these amazing leaders, I turn the microphone over to my friend and fellow Brown School alumna, our Assistant Dean for Community Partnerships, Cynthia Williams. Cynthia.
Thank you, Janet. And I have to say I'm equally so starstruck by this panel. And we're going to begin with Mayor Jones. Greetings to you, Mayor Jones. Thank you so much for joining us today. We're going to start off with a question to you. The Social Workers for St. Louis initiative is the signature part of your administration's approach to city government. And as a key aspect of your public safety framework, would you please start the discussion by explaining the basics of the initiative, please?
Yes, thank you for having me. Dr. McKay, I've always said this to her and all of my friends over at the Washington Brown School of Social Work, that I believe that social workers are miracle workers. And so I was excited to find ways to partner with Washington University to bring more social workers into our city government, because I've often said that we have to put the public back in public safety. So the Social Workers for St. Louis initiative is one way I'm actively working to do that. This is an innovative program aimed at integrating mental and behavioral health into public safety. When the right professional is deployed to the right call, we are better positioned to meet the needs of our residents. So we plan to hire 20 to 30 social workers to have the appropriate person respond to behavioral and mental health care needs to support our community.
Thank you so much, Mayor Jones. Deputy Director Muhammad, this question is to you. The St. Louis Area Violence Prevention Commission is a regional cross-sector collaboration and an integral partner as the city focuses on serving the most vulnerable citizens in the city. Would you please tell us about your role and share how this initiative aligns with the approach you and your colleagues have taken to respond to needs in our community?
Sure, thanks for having me. So VPC is a convening table. We work with and support social service organizations, government, institutional partners, funders, but most importantly, we listen to and work with community members and community advocates to really understand how people and communities experience violence. And then we do our homework to identify solutions that have some evidence for being effective at addressing root causes of violence. So basically, we're relying on the 4 elements of a public health approach. Number 1, define and understand the problem. Number 2, identify risk and protective factors. Number 3, develop and test proven strategies. And number 4, assure widespread adoption. So the model that the Mayor Jones just described is a perfect example of this administration identifying a proven strategy and then deciding to test it in St. Louis. I should emphasize that just because public health is described as having 4 steps, each step is not a simple lift, especially with an issue like violence that is deeply emotional and has vastly different personal impacts on people's mental, emotional, economic, and physical well-being. So when you're working with a victim of violence, for example, a mother who is grieving the loss of a young child, she doesn't necessarily want to hear about 4 steps or long-term strategy. She wants an immediate solution. And of course, people who live in neighborhoods where they're hearing gunshots as a part of their normal daily noise, their solutions are usually different from people who go home to peace and quiet every night. So I'm saying all of this to say that we emphasize the fact that violence is a complex issue that requires strategies across multiple fronts. So our role is to work with the mayor's office to support a comprehensive strategy so that all elements of the mayor's plan have the environment, resources, and the supports necessary for them to be successful. So we don't want to reinforce the expectation that there is one solution to violence. Our region has the opportunity to ensure that all of the systems and resources that these social workers will need to navigate care, to provide tangible benefits to individuals and communities are in place. So VPC works with a network of partners to focus on the policy and systems changes that are needed so that these social workers and the community at large can actually find and access the effective services they will need to not only help people heal and recover from violence, but to prevent violence from occurring in the first place. So this means ensuring that we have economic mobility programs that are effective at serving families that have experienced generational poverty, that we have culturally competent therapy and counseling services that can address toxic stress and trauma, that our emergency assistance programs are redesigned so that they can actually help stabilize households long-term and not just move them from one crisis to the next. There's a considerable amount of ecosystem work that needs to happen to ensure that the systems are ready to fully support and advance this social work initiative. And that's VPC's commitment to the mayor's office, to the city of St. Louis, to really advance these transformational policies and systems that will improve our region as a whole.
Thank you so much, Deputy Director. Dr. Joe, coming to you, sir. As an expert on mental health in young adults, would you please share some of your thoughts about the importance of embedding qualified social work professionals in the delivery of city services, and what might be different as far as outcomes for city residents because of this initiative?
Well, there are several ways you can look at this. So one, I deal in the area of suicide prevention and serious mental illness. So we have seen many situations across the country in which when law enforcement is sent out to deal with mental health issues, there are times that it leads to inadvertent death among those who are seeking the care. So having social workers who are well-trained, who have a diverse background, capable of working in multiple different types of settings, and having expertise in a variety of areas, whether it's domestic violence, whether it's serious mental illness, whether it's substance use, it's a good partnership and a maturing of a public safety response system where you would now match those who are really qualified to deal with the issue, assess the issue, and then get people to the appropriate care. That means making the right referrals. So for me, some natural outcomes is that we're going to have much more greater reduction in one, criminalizing behavioral health and mental health issues. We have less likelihood of resulting in inadvertent death among different parts of the population. But more important is a better service to residents in an area if they know they can get the quality of care when they have great amount of need. So I think we can look both at some science as well as some practical evidence that it makes a difference when you match the right provider to the need, and thus we can then have, again, better way to better serve the residents of the city of St. Louis.
Dr. Joe, in your opinion, how will we know if the initiative has been successful?
Well, again, there's a couple of things. Again, as I mentioned, people will feel better served when they know that they have a need and they can get the right response to that need. And I think at the different agency levels, that's where you're going to begin to at least monitor or track some of those things. Also, you're less likely to have cases in which, again, those who are not prepared, who are not trained as social workers are trained to deal with some of the issues that are not criminally related. And again, that's an important part of this. We're going to begin to see some evidence that those sort of interactions are not leading to adverse outcomes. And then finally, it frees up, because again, there's a lot of evidence, there's a new paper in Scientific America about this, it frees up public safety officers to be able to better address crime and people's sense of personal safety. So again, you'll be able to hopefully see some of that evidence over time in that arena as well.
Thank you. Good afternoon, Dean McKay, and here's a question for you. You have substantial experience in the fields of social work and social policy. Can you comment on how you see the role of social work changing and what differentiates social workers from related professions?
Well, thank you. And thank you to our panelists. I'm super excited to contribute. So we are in orientation week here at the Brown School. So I'm going to flip into my professor mode, if you can stand it for just a minute, because not all of us are social workers on this particular webinar. And so I just want to explain what social workers potentially bring to this opportunity. And it might be even more expansive, a role once we get into working together in a collaborative partnership. So social workers are trained to understand the person, the individual in the environment. And so there's really substantial preparation for social workers to actually address the consequences of what Sean is talking about, the consequences of mental health challenges, the consequences of trauma, the consequences of, deep burdens or structural barriers that they experience. But that's only one side of the profession. The other side is what Dr. Muhammad, you talked about, the root causes. And so if you think about the kind of preparation that social workers will have as they enter this partnership with the mayor's office and in partnership with community and partnerships with constituents, is that they're going to bring a lens of how do we help individuals, but how do we also really change what happens to a population? What are the experiences in a community? And honestly, Mayor, get ready, because social workers are disruptive. So they both will learn about the system that we have created, but we also know that we don't want to replicate the outcomes that system is creating. And so it's really kind of multi-level tools and skills that social workers bring to really try to change not only and support individuals, but also alter their experiences of safety in the community, change the way that programs are developed and delivered, hopefully in a real collaborative spirit with those that need them, and really change business as usual. And I think that's what you ran on. And that's a very important match for our community. The last thing that I will say is that social workers are actually trained to tackle issues that are hard to talk about. So what does it mean to center racial equity in an experience where some of our Black and Brown neighbors really disproportionately experience trauma and denied opportunities and interact differently with the criminal justice system? So it's really important that we kind of tackle issues that are incredibly important to our city and are holding us back. And so I couldn't be prouder of the boldness and the risks, but also the potential that this partnership holds.
Thank you, Dean McKay. Mayor Jones, back to you. Would you please talk about how this initiative will complement and fit into your overall efforts as you lead the city? And what will you be looking for to determine whether the initiative is successful?
Well, normal hasn't worked for many of our residents for years. And so just like Dean McKay was saying, social workers are also disruptors. So we are looking to disrupt and transform our current public safety system to one that is outward looking and helps people. So the increased number of social workers will help the city with our diversion call efforts by connecting people to the right resources. And of course, hopefully there will be fewer people involved in the criminal justice system. Just in February, we started the Cops and Clinicians program, and already they're starting to divert people from entering our criminal justice system. I think 70+% of people that have been encountered by the Cops and Clinicians program have been diverted from entering our criminal justice system. Our social workers will also support our Department of Health and the Department of Human Services staff on a variety of duties, including victim support services like Serena talked about, support for our unhoused, and conducting pretrial mental health screenings. These are just a few examples of the important work that they'll be doing. And so job descriptions and other details, of course, I got to put in a plug, are available on the personnel department's website, and they'll be available next month.
Mayor, I'm going to stay with you and ask you, there are multiple models emerging about the use of social workers in non-traditional roles, such as city government. Were there particular models whose plans served as models for the social workers St. Louis initiative?
Yes, one of the other things I ran on was having a national network of elected and appointed officials where we can get ideas from, so we don't have to reinvent the wheel. And one of my best friends is the mayor of Denver. His name is Michael Hancock. And so I was inspired by the work that they were doing there So in July, I traveled with Congresswoman Cori Bush to learn more about their support team assistance response method, better known as STAR. The STAR program redirects some 911 calls to mental health care professionals and social workers, and they also team up with an EMT person. So we were able to share best practices, discuss pathways for funding public safety programs like Cops and Clinicians. And in Eugene, Oregon, and their CAHOOTS program is another example. CAHOOTS stands for Crisis Assistance Helping Out on the Streets. And they started integrating mental health into their community policing programs over 31 years ago. So this isn't new. There's plenty of research and data that shows that this works across the country. And so with CAHOOTS, instead of responding with law enforcement officers, they deploy a medic and a mental health worker to address issues, and they do not use weapons or apply the use of force.
Thank you, Mayor Jones. This question is to you, Dean McKay, and same question to you, Dr. Joe. What role, in your opinion, can universities play in supporting new approaches to public safety and well-being?
So Sean, I'm going to just make 2 comments and turn this over to you. Mayor Jones, you identified evidence-based approaches, and that's what universities can create and co-create with you and then test those. And so in another question, I'm going to talk about the importance of data, but I think that partnership with us to find and locate and analyze the best evidence-based approaches so that you can use what we do best at universities and get our best recommendations. But Sean, please.
No, I think, Mary, you hit the nail right on the head. Universities are good partners, co-conveners, and collaborators. So particularly for social workers. So social workers are not just answering a question, they're also answering the question of how do you implement something? So we're good partners around figuring out scaling, because now we're in a 21st century vision sort of settings where we have to be able to figure out how do we take things to scale. It's one question how to implement another strategy, but then how you take it to scale so most of your residents are benefiting from it. And that's where university partners are very helpful, as well as vetting other ideas, because they are consumers of information on an ongoing basis, so they could be a good translation partner to say, how do you take that information and do it in a practical way to address public safety or anyone's sense of personal safety? So these are important things universities can do, and data-driven decisions is the cornerstone of that. Whether it's evidence-based strategies or new data we need to collect, they're very good partners in helping any region or city be able to prepare itself for redesign, reinvigoration, or redeployment of resources.
Thank you. Deputy Director Muhammad, for the social workers who would take on these roles, what types of preparation and experiences are essential?
So I think lived experience is important. And to the extent that we can begin to think about who we recruit into these roles, being able to connect to communities that are directly impacted, bring them into positions where they're able to receive this type of training and support that we've been talking about so that they can work directly in a peer-to-peer relationship. I know in the mental health world, we put a very high premium on peer and near-peer support, because when an individual is in crisis, they want to know that they're talking to someone or working with someone that has been where they are and has gotten through it. And that ability to be relatable and familiar goes a very long way in gaining trust and respect when you're actually seeking to help someone. So to the extent that we can actually bring community into the solutions, into the problem solving, I think that's important. If you don't have lived experience, of course, then just be authentic. Be the person that recognizes humanity in others and is willing to do whatever you can to help people realize their potential. I would say familiarize yourself with the Missouri model of trauma-informed care. One of the things that Missouri has done very well is develop kind of the sequencing for what it means to become trauma aware, trauma responsive, and trauma sensitive. It's not a curriculum, but it's an approach or an understanding of what it means to actually be in community with someone and to help them move from where they are to where they desire to be. And then lastly, I would say enroll in a really good racial equity training program that actually allows you to create a learning cohort so that you can have support along the way. So racial equity is not just kind of one training or one book, but it's an ongoing process of being in community with folks who have shared values and are trying to move in the same direction.
Thank you. Dr. Joe, same question. What types of preparation and experiences, in your opinion, are essential?
And it all depends on what setting we're going to set these social workers in. So from a public safety setting, it's going to be critically important that they understand the use of data. Here's one important reason. They're going to be disruptive. They're going to be disruptive because they're going to say, what have we tried for 40 years and what has been an outcome? What have we tried for 30 years and what has been an outcome? So can we do something transformative? They have to be competent. So you got to train them to make sure they understand the nuances of public safety systems, the role of information, the role of community perspective and community involvement. So these are important background experiences they have to have, in addition to the wonderful things, and I think the right things that Serena mentioned. Lived experience is very important, but then also a level of competence so they can bring added value to the discussions, to the policy discussions, to the strategy, to the interventions, to be able to mediate. And that's one of the important skills that social workers are very good in working in groups. So mediation and facilitation training and skills and backgrounds can be necessary. But most important is competence to understand how public safety systems operate and what can we do to strengthen them and making sure that people are getting the needs met. And that's really centered around the idea of their personal safety.
Thank you, Dr. Joe. Mayor Jones and Deputy Director Muhammad, you both are committed to revisioning public safety. Can I start with you, Mayor Jones, and ask, can you share a bit about your joint work in this area? And then I'll go to you, Deputy Director.
And so one of the things I love about this work is I get to collaborate and work with my friends. And so I am so excited to collaborate with Serena and the Violence Prevention Commission to host community public safety town halls. This is another way that we're putting the public back in public safety. So we're inviting the community to join us for our first one on Thursday, September 23rd, to share their ideas and solutions on how to make St. Louis a better place for everyone to thrive. I often believe that the people that are closest to the problems are closest to the solutions. So in addition to town halls, we're going to host community cafes or intimate gatherings with community leaders and people directly impacted by violence and crime. And by working with VPC, we jumpstart this process. St. Louis is notorious for making plans and writing reports and putting them on a shelf to collect dust. We cannot afford to do that anymore. So by working with VPC, we are basing our efforts on past report findings and moving deliberately to take action on those findings.
Thank you. I'll go to you, Deputy Director.
I'll just add that I have known Mayor Jones for most of my professional career, but this is my first opportunity to actually work with her and her team directly. And in the short time that she has been in office, her team has been very collaborative and interested in seeking out community partners, which is very refreshing. I've mentioned that VPC works with partners in a variety of sectors, including law enforcement. And one of our goals is to strengthen police legitimacy. And for those who don't know the term, police legitimacy is the degree to which residents believe that the police are honest, trying to do their jobs well, and are trying to protect the community against crime and violence. So when we talk about re-envisioning public safety, it's important that we're able to work directly with law enforcement to ensure there is room for community voice and decision-making, whether that's through collective bargaining agreements or planning processes. And I'll say that the Office of Public Safety under Mayor Jones has made significant early commitments to intentionally engage and listen to community members. So we're very hopeful to continue to strengthen that relationship so that our public safety strategies are more aligned with our overall public health approach.
Thank you. This is a very exciting and robust conversation. Thank you for your responses. Dean McKay, I'm coming to you. What are some of the key considerations that must be in the forefront to best support the success of initiatives focused on bringing social work expertise into new settings?
So in some ways, the mayor and we as a community are trying to address an urgent, overdue matter. And so that will try to go very quickly. But to go too quickly has us lose some things that I think are really important to set the foundation for any new transformative initiative. So what do I mean by that? To deeply understand what are some of the root causes and the contextual considerations that really need to inform something new. We have to take the time to really be sure that we understand. And so the voice, Mayor, that you're talking about, community voice, is incredibly important to have at the front end and the foundation of this project. The other thing is that we do have to shore up our commitment to change. You're at a panel now that is very public, that expressing your commitment to change. There are many layers within systems and institutions that may be less committed to change. And so how to actually bring about alignment with the many partners that are going to need to be in this together, I think is going to be critical. And if you go too fast and you miss that step, then you spend a lot of time fighting about things that are not the real issues. And so I think to really set the foundation, make sure that it is based on strong collaboration, make sure that there are feedback loops, not only things that you want to hear, because there's a lot of wows in the chat. Those of you that are, people are inspired by this, but there's also going to be mistakes. There's going to be choice points that you want hard feedback. And so to make sure that those are really built in. Our values, our ability to communicate those, get on the same page, build trust with each other. St. Louis is an extraordinary place. And yet that work of us being able to really work together in a transformative way, in a way of real struggle, we're going to have to do that hard work. And so leadership matters. And so I'm incredibly grateful that we're coming together like this.
Dr. Joe, I'm going to ask you the same question, sir. You are a great founder and creator. And so I'm going to ask you, what do you think should be in the forefront to supporting successful initiatives, bringing social work expertise into new settings? What is your feedback?
And I try to just add new value because Dean McKay covered a lot of it. One of the important things that we try to look at now in community capacity building is the capacity to serve. So we really try to be honest to say that even if this transformative initiative, you got to really also put in context how many people that can actually reach. And we really bring that kind of hard line analysis because what we want to do is to help sustain transformative initiatives and sustain them over time. So that analysis is really, really important. So as Dean McKay, those are some of the pain points and decisions that as we begin to move forward, we take data-driven approaches to really understand the potential scope and effectiveness of our strategies and really how do you scale up. So again, you bring that thought partnership, and this is a wonderful opportunity to do that. You're talking about infusing new talents into an arena that everyone talk about the ecosystem change. There's a lot of players you got to collaborate with, but at the same time, you have to give them the information so they can understand the full impact of their strategy, and then say, well, now, and I also understand what does it cost, and to do those sort of fine detailed things, the things that sometimes we jump over because we're so excited about the initiative, as Dean McKay say, that we got to do this additional formative work because it impacts the sustainability of the strategy, and that's one of the most important things. One of the worst things to do is build something great and then can't keep it, because again, we've seen this sort of cycle before across the country. So I'm really excited about this, and you have the right set of partners that's coming together. So the leadership that's either put this panel together and is part of the mayor's team, again, I think you have the right thought partners to keep things moving.
Thank you, Dr. Joe. Deputy Director, what factors will be important to building a better understanding of how intertwined law enforcement, mental health, public health, and social services are in crisis intervention and addressing the needs of the most vulnerable and residents of a community?
So I think we focused on crisis intervention a bit in this conversation. So I want to focus on the second half of your question about addressing the needs of the most vulnerable residents of a community,
Yes.
Because I think that's where we have significant opportunity to do something different. So as you know, we're approaching the end of Black August. For those who don't know about Black August, in 1961, George Jackson was convicted of armed robbery. He was 19 years old. He was sentenced to a prison term of 1 to 51 years, which basically meant that prison administrators had complete and arbitrary control over his life. He served 11 years, 7 of those in solitary confinement before he was killed in prison. During his time in prison, he served as a field marshal of the Black Panther Party, and he committed his life to study, train, and fight oppression. So we take Black August as an opportunity to reflect on freedom fighters that we have lost and recommit ourselves to Black liberation. So what does this have to do with addressing the needs of the most vulnerable residents of the community? I think everything. Public safety is not just about policing or even social work. Because our institutions have failed people for so long, these systems as they are cannot meet the needs of communities that have been abused. Systems do not self-correct. It takes that external pressure. It takes organized resistance and movement from the people directly impacted by those systems. So I think the most important factor for providing the types of supports that people actually need is our ability to shift power dynamics and support community-driven decision-making. Communities have told us what they want and don't want from law enforcement. They've told us what makes them feel safe and what doesn't, how and when they want to access mental health services, what types of basic needs they have that are not being met. We just have to get very serious about listening to what community is telling us and act accordingly. That's why I think the community town halls and listening sessions that Mayor Jones just described are so important. Change has to come from the masses and the people. We are fortunate to have elected leaders in place who deeply care about the community. We've already talked about the commitment of this panel. Now we need the community to continue to show up and give voice to the change that needs to occur. We have done needs assessments and plans. We've launched initiatives, and everything has kind of felt like incrementalism. So in this moment, we need to do things a little differently, think differently, and really focus on how we center community voice in all of our actions. I think that's the only way that we can truly lift everyone and not just a few. So to Sean's point, even as we launch this initiative, it's not going to reach everyone. So our focus has to be on those most vulnerable and how we create the conditions that allow them to exercise their own power and authority to make these systems more responsive to their actual needs. So I like this idea of social workers as being disruptors, because we need that type of partnership between our institutions, our elected officials, and our community members to actually disrupt and change what we're trying to accomplish here.
Thank you. Dr. Joe, this question is to you, sir. Social workers, if called upon by the police in the areas of crisis prevention, mediation and referrals, intervention in domestic violence, elder abuse, mental health, what do you think they will need to provide in those situations?
I'm going to ask you to repeat it, but I was really with Serena, and I wanted to jump in because she's hitting some key points.
Okay.
One of the disruptive, if you don't mind, give me
Please.
one of the disruptive things that this initiative has the opportunity to do is that we have to build multiple venues for residents to be able to express their sense of fear, their concerns for their personal safety. Like, one of the things we understand in this science work is real simple. Youth pick up guns or join gangs because they feel that the system that's in place is not going to serve their needs. So it's also an evaluation of the efficacy of some public safety systems. But now imagine you release the information from communities so that they know that their concerns are reaching transformative leader like Mayor Jones and others who are making decisions. And then there's a response that's meeting directly their needs. Now you get rid of the idea that community and public safety systems are not working collaboratively. But if you don't build that capacity, these town halls are part of it, but you have to create broader infrastructure so more residents have easy ways, and we have a lot of technology now to let you know what their concerns are. You're going to begin to see some increased trust if that response to their needs is showing up in their lives and more people. So we have a great opportunity as a region to transform that. Now, I want to answer your other question. So if you could slightly repeat that, I will do that as well. So,
I will. Yes, I will. Will you talk about the support that social workers can provide if called upon by police to intervene in the areas of crisis prevention, mental health, elder abuse, domestic violence?
Right. So there you have a partnership that you can release. And I think the mayor hit on two major examples that's been leading the country for a long time. And I think Cahoots and STAR are the two major capstone strategies that's out there. What you have in that partnership is that, and again, some of the literature is pretty clear that there was very little required, like less than 2% for police intervention in those experiences when both social workers and police went out. So the idea is now you have professionals who are trained to actually respond to the need, to be able to reduce or de-escalate a situation, to be able to assess and then refer people for appropriate services. And then most important, to be able to follow up. We can't forget that. It's not just you're going to refer, but to be able to follow up. And if you build your system right, you will have all those components. So you have an appropriate trained practitioner who could then respond to the variety of needs, whether it's domestic violence situation, whether it's interpersonal violence between individuals, whether it's someone who's SMI and having a psychotic episode. You have the right professional to be able to assess the situation, make the right referral, and encourage the right follow-up. And at the same time, you have a partnership with law enforcement. If there's a criminal aspect to it, then it can address that. Because if you don't, here's the situation. Law enforcement are trained to provide response to criminal issues. So that psychotic episode would then be assessed as a criminal issue, because if they come in any way towards law enforcement, they have to defend themselves. So now you made what was a mental health need a criminal criminal justice response, and that could lead to incarceration, that could lead to arrest, versus having a social worker there who can then make the right assessment, make the right referral. And again, public safety is addressed because it was not required to de-escalate and get people to the right services.
Thank you, Dr. Joe. I want to open up this question to the entire panel. Would you please talk about the importance of ensuring that there are trained social workers in the development of safe spaces for youth and young adults and the delivery of services to young people in our community? Would anyone like to volunteer to start? I'll volunteer you, Dr. Joe.
You know, I try not to speak too much because we have our mayor here, you have Serena here. These individuals have been doing this work for a long time. I just think we're in a unique opportunity as a region that if we have significant intentional investment in the support, what I call increased capacity to support and extend the reach of care to these young people, to help them with the right set of goal settings and then support them over time. We have a ripe opportunity to do something no other city has done, and that's really transform the outcomes for our most vulnerable populations. I call out Black males, as many of you know, and I think that's critically important. And if we don't come to cultivate the will to invest in that group, from boys to young men, again, their success is tied to the future of the city. The best that St. Louis can be is dependent on the best that we can support them to be as individuals. So I have a lot to say about that, but I'm going to hold on and let my colleagues weigh in.
I want to pick up on that, the importance of Black males. And if there's anybody out there that's considering a career path, we need licensed clinical social workers who are Black males. We get calls from families all the time where they're looking for someone who is willing to talk to their son who is struggling with an issue. It could be a range of things. And what we find is we can do cultural competency training, we can do cultural humility training, all the trainings. But for that first initial contact, there are so many families who are hesitant to reach out to services because they don't feel like there's someone who looks like them who's going to be on the other end of that call. So to the extent that we can really be intentional in how we do recruitment, how we engage the workforce, how we train people, all of those things are important because there are young people who do want to receive mental health services. I know there's this myth that Black people don't like mental health services and we don't want therapy and we don't want counseling. And that may be true for some people, but it's not a universal truth. And there are Black families out there who are looking for those types of supports. And we need to think about how we can diversify and strengthen the workforce to be responsive to those families.
Thank you. Dean McKay, would you like to add?
Oh, my colleagues are so wise in this space. You know, I think Dr. Muhammad just identified our next initiative in collaboration, which is how is it that we are creating a truly responsive pipeline into this profession back out to community. And so you probably haven't seen the last of offers to really collaborate and really work together. And so that's a disruptive idea that would meet so many needs. And so, and just, it feels like we're just getting started. So thank you.
Thank you. Here's a question for you, Mayor Jones. What would you say to individual residents who want to help St. Louis thrive?
Excuse me. I know this seems like a really simple answer, but it's true. It's going to take everyone at the table. And that means everyone. We're going to have to build a large table where everyone can come and give their input and all leave our egos at the door. And because the North Star should be making St. Louis an equitable place for everyone to thrive. And so I encourage people with social work backgrounds or similar qualifications to apply and join our workforce when those openings become available. I want you to help me transform public safety in a way that's going to be disruptive and hopefully outlast my administration. When I am long gone, off doing something else, I want to be able to look back at this time and at this place to say that we all work together to create and transform a public safety system that truly put people at the center. And I also want to challenge residents to reimagine how they think about public safety and be open to innovative solutions. And last but certainly not least, you can join your government by joining a board or commission. We have hundreds of people serving on expired terms or vacancies within the city of St. Louis. So when please go to our website and look up boards and commissions and figure out how you can serve your city, because a lot of times we have a small number of the same people serving on boards and commissions, and this is the most important way to volunteer and help the city move forward.
Thank you, Mayor Jones. And I'm going to open this question up to the entire panel as we're approaching the end of our hour. What closing thoughts, or what do you wish you had said that came to you as others were speaking? What are your closing thoughts on any of the questions that we've asked previously? I don't want to put anyone on the spot. Mayor Jones, I'm going to come back to you last. And I'm going to start with Deputy Director Muhammad and ask her, what closing thoughts do you have for this discussion?
So I think I want to focus on something that probably sounds operational, but it is going to be different than what we traditionally do when we think about workforce. We really need to think about staffing models that allow space for intentional rest. So I heard Mayor Jones refer to social workers as miracle workers, and I agree with that. And I think we've all gotten into the cadence of working as hard as we can all of the time. And what we're talking about is putting people in a space where they have to be responsive to communities that are at a heightened sense of crisis on an ongoing basis. And that requires a different way to approach staffing. So like if you have a 40-hour work week, 10 of those 40 hours should be directed to rest and recovery. And I'm not talking about requesting a vacation day. I'm thinking like you start or end your day with time for you to heal and recover. And then we need to have enough staff to rotate people out so that when they have those intensely traumatic experiences in a workday, they have space for self-care. I've been working on COVID crisis response for 12 months now, and I can say from personal experience that you cannot be in crisis mode 24/7 and not have it take a toll on you mentally and physically. And it is, we're grateful to folks who are willing to step up and make those sacrifices and be in those spaces. And I think we need to think about how we design a staffing model that allows them to do their work, to be well, to be present in their families, to have connections in their communities, to not re-traumatize folks that they come in contact with because they're starting to burn out, and really acknowledge that in this space, rest is not a luxury, it's a necessity. And if we're calling on people to do extraordinary work, we need to structure their workforce so that they have the supports to be able to do it in a way that's not harmful to themselves.
Thank you so much.
All right, Ms. Dean McKay, would you like to go?
Please, Dr. Joe, go ahead.
There's so much I can say here. I just think we have a 21st century opportunity in front of us in some concrete ways. And a lot of there's a lot of initiatives on the ground that can leverage us to make sure we have the digital infrastructure as a region. You have to have greater connectedness. And it sounds, again, somewhat operational, but it frees up people to do more work when you have an integrated social needs care, digital infrastructure connecting with your healthcare system. I think we undervalue the importance of building our technological infrastructure, especially within the human services area. So let me say, we assume there's more capacity than there is. Let me just say it real simple. And it doesn't allow us to drill deeply down in specific areas that we need to invest in to make sure that residents are having access to the care that they need. And this also results in their demands for public safety. So I just think we need to examine the full capacity. And this is where I think universities could be helpful. You got a ton of them in the region, including us. These are partnerships that can help you leaders in the region address some of the needs where they don't have enough time. Their staff don't have enough time, that we can drill deeply, because we tend to focus deeply on an issue. And let me be more practical about that. So Mayor, I love the fact that you have boards and commissions for the city. You have several universities that train people around volunteering. They got graduates. I know our graduates, 50% of them stay right here in St. Louis. And it'll be a nice thing to consider, Mary, of how do we find those with interest and expertise to be in a constant pathway so you have options of those who can fill those positions, because I think sometimes we don't have the capacity to find people and then allow them to volunteer and train to be volunteers. So again, capacity must be examined. If we're gonna, if that's the additional thing I would push, capacity and intentionality to go deeper in the work.
Thank you, Dr. Joe. Dean McKay.
So I've heard at least 2 or 3 new initiatives besides the one that we're supposed to be talking about today, of things that we should work on together. And so, you know, don't underestimate the power of bringing together a panel like this with people with deep commitment. And so you should ask and re-ask and keep asking for ways that we can help further this agenda. And so I think that that's really important, that an expressed commitment to not only this collaboration, but many, many others. The last thing I want to say is that I'm starting my 6th year in St. Louis, and I continue to get up every day and really believe that these are solvable challenges. There is a scale here that is different than New York City, where Sean and I have spent a lot of our time here. We can wrap our minds around the children of the city, support the families in raising their children, support our communities. And so I think that this is a group of people, but there are a lot of us in this chat that are really wanting to work together in new ways. And so we're going to try to keep this an honest, humble, but transformative, impactful process. And I'm so happy to be a partner of it all.
Thank you, Dean. And the final word, Mayor Jones, goes to you.
So I want to go back to something Sean said earlier. We touched on this, but I think we need to underscore it a little more for those who think that the changes that I am proposing will make us less safe, or those who are upset that they think that this is somehow defunding the police. The changes that we are proposing will actually free up our officers to do the work that they were trained to do in our academy. Our officers are exhausted and are deployed for every 911 call that hits our 911 call centers, whether they are equipped to handle it or not. And that's how we get some of our bad outcomes when we have officers responding to situations they're not equipped to handle. So what we are talking about, this whole initiative is actually going to free up our officers to do the work they were trained to do, to get other training on how to handle other situations and make our response to our citizens in a more holistic manner. Because that's what's required of our situation right now. That's also how we've gotten a whole host of bad outcomes. We've seen time and time again on the news when officers respond to situations where there's someone who is in a mental health crisis, and that person sometimes loses their life because the officer doesn't know how to understand how to interact with that person. These solutions involving more social workers and other licensed professionals in our public safety response allows us to respond in a way where that person gets the help that they need, the help that they deserve, and continues to live and to thrive. So I think that that's the final point that I want to make, in that we have to, this is a way to disrupt, but also to transform our public safety system for the better and for the good of everyone who interacts with our government from here on in.
Thank you, Mayor Jones, Dr. Joe, Deputy Director Muhammad, and Dean McKay for the privilege of moderating this very, very special panel and this discussion. We are at the end of our discussion. We're going to end a minute or two early, but on behalf of myself and my co-moderator, Janet Gillow, and the Brown School at Washington University in St. Louis, thank you so much for your contributions today and for helping to make St. Louis a better, thriving city. Enjoy your afternoon.